Blood pressure is one of the most tightly regulated variables in the body. To understand how drugs affect blood pressure, we need to understand how the sympathetic nervous system controls it, and in particular, how alpha and beta adrenoceptors shape cardiovascular responses. Blood pressure is described by a simple equation. Mean arterial pressure equals cardiac output multiplied by total peripheral resistance, also called systemic vascular resistance. Cardiac output depends on heart rate and stroke volume. So, blood pressure can be changed by altering how the heart pumps or by changing how wide the blood vessels are. Here's a simple visual model. The heart acts as a pump, generating flow, while blood vessels provide resistance to that flow. With each heartbeat, pressure rises and falls around a baseline. If the blood vessels constrict, the resistance to flow increases. The same heartbeat now generates a higher baseline pressure, even though the heart itself hasn't changed. With each heartbeat, pressure now rises and falls to a higher baseline. This diagram focuses on the arterial side of the circulation. That's because arteries and arterioles are the main determinants of blood pressure. Veins are important for venous return, but they play a much smaller role in setting arterial pressure. During fight or flight, the sympathetic nervous system is activated. This doesn't affect all organs equally. Blood flow is redistributed to where it's needed most. The rate of the heartbeat and its contractility increase in response to activation of beta-1 adrenergic receptors. So cardiac output and blood pressure rise. As the heart works harder, beta-2 receptors dilate the coronary vessels, increasing blood flow to the myocardium. Beta-2 receptors also dilate blood vessels supplying skeletal muscle, preparing them for activity should flight be needed. But blood volume is fixed. To maintain blood pressure, vessels supplying the organs in the abdominal or splanchnic area constrict via alpha-1 receptors, increasing resistance and redirecting blood flow to where it is most needed. Alpha-2 receptors are located presynaptically on sympathetic neurons supplying blood vessels. They reduce noradrenaline release, acting as a brake that fine-tunes sympathetic tone. In summary, blood pressure equals cardiac output times peripheral resistance. Alpha receptors mainly control resistance. Beta receptors mainly control cardiac output and flow distribution. It's coordination, not uniform constriction or dilation.